on the news track.
COVID fight over Bharat Jodo. Health Minister red flags Congress Yatra. Rahul says COVID only a bahana. Full war over COVID preparedness. India gets COVID battle ready. Pandemic politics returns. Big focus on News Track.
Here's a look at the headlines I'm tracking tonight. Prime Minister Modi reviews India's COVID preparedness, cautions against complacency. PM advises the country to mask up. Big boost to India's COVID fight. First Desi needle-less vaccine ready for rollout. Covaxin nasal vax will be given as a booster dose to those above 18 years of age. Karnataka government passes a resolution seeking status quo on the Belgavi border dispute. Bommai government says it won't give an inch of land to Maharashtra. Big setback factor. Jacqueline Fernandez court objects to her plea seeking permission to travel abroad. This after the Enforcement Directorate had called the actor a flight risk. RRR's iconic hit Natu Natu in the race for the best song at the Oscars. 4 Indian movies including Cello Show also make it to the Oscar shortlist. With China reeling under a COVID mayhem, India is ready with its battle plan. But in this fight against COVID, Congress's Bharat Jodo Yatra has become a major flashpoint. The health minister has red flagged the yatra, citing violation of COVID protocols. But the Congress is claiming it's a conspiracy.
Marching ahead in the face of looming COVID roadblocks. Day 106, Rahul Gandhi's Bharat Jodo Yatra on the second day of its Haryana leg, after it entered the BJP-ruled states from neighbouring Rajasthan. With China's COVID chaos causing a global alarm, the Union Health Minister's letter to the Gandhi Scion to follow COVID protocols or postpone his nationwide march in the national interest has fired up a political back and forth in the middle of Bharat Jodo.
मैं भारत सरकार का हेल्थ मिनिस्टर होने के नाते मेरा दायित्व है कि देश में कोविड ना फैले, देश के सभी नागरिक स्वस्थ रहे, लेकिन कोई खास फैमिली के प्रोटेक्शन में आके एक देश के हेल्थ मिनिस्टर अपना दायित्व अदा करता हो तो उसके खिलाफ भी प्रश्न उठाना ये मेरे कर्तव्य निर्वहन करने के लिए बाधा रूप है.
The health minister's sharp comments and his advisory note to Rahul Gandhi drew a sharp reaction from the Congress leader. He called Mandaviya's letter evidence of Yatra's success.
अब इन्होंने नया आइडिया निकाला है. मुझे चिट्ठी लिखी, कोविड आ रहा है, यात्रा बंद करो. अब यात्रा को रोकने के लिए बहाने बन रहे हैं.
The yatra, now coinciding with China's COVID crisis, has thrown both Congress and BJP camps in top gear.
The letter written to him by the Union Health Minister Mansukh Mandaviya and said that now they have come up with a new bahana, that is that of COVID, to stop this yatra. However, the Congress is saying that the yatra will continue to march towards Kashmir. Yatra will be reaching Delhi on December 24th.
On its part, Congress has gone full throttle in its defence of Bharat Jodo Yatra, alleging that the central government is using the COVID surge in China as an excuse to put brakes on the march.
Mr. Modi did Namaste Trump in the month of February, and in the month of March he delayed the imposition of the lockdown by 1 week. This is a party that plays dirty politics. This is an attempt to derail and defame the Bharat Jodo Yatra.
Meantime, some protocols returned swiftly in Parliament. Members attended Thursday's sitting wearing face masks. Outside, the BJP central ministers trained their guns on the Gandhi dinner city, using COVID protocols as ammunition.
सवाल ये खड़ा होता है क्या एक परिवार सब प्रोटोकॉल से ऊपर है?
Closer to the national capital, the Bharat Jodo Yatra draws more spotlight than before as COVID politics heats up once again in the country. With Supriya Bharadwaj, Bureau Report, India Today.
At this moment, there are 155 reported cases of COVID across India. The Delhi Chief Minister says there's no case reported in Delhi at all. Given the current situation around COVID, is there really a reason for the Bharat Jodo Yatra to be suspended, or is the central government just trying to derail this yatra because it's an opposition yatra to try and stall Rahul Gandhi's march? Joining us on this broadcast, representing the Congress, Dr. Ajay Kumar. We've got Dr. Syed Zafar Islam from the Bharatiya Janata Party, Subramaniam Swaminathan, Director Infectious Diseases at the Gleneagles Global Health City. Dr. Ankita Baidya joins us, Consultant Infectious Diseases at the Manipal Hospital. Let me go across to Zafar Islam first to try and explain to our viewers, given the current situation around COVID, the logic behind the Health Minister's missive, who in the end says, keeping the public health situation in mind, if you can't follow COVID protocols, please suspend the Bharat Jodo Yatra in national interest. Given that we had 5 reported cases this week, a total 155 cases nationally, explain the logic. Are you playing politics? Are you really worried about public health? Syed Zafar Islam.
Rahul, I'm sure that everybody in the entire nation knows that when the Bharat Jodo Yatra had begun, it's been since September. We had 2 elections. We have many elections actually during this period. Did we say anything to him? But last 3 days, just do a back testing of last 2 days of all the news coming from the from different parts of the world regarding COVID, and you will get to know that there are massive disruption in China because of COVID. There are many deaths in China. Full reports are not coming. You have many cases in Brazil. You have many cases in Japan. You have many cases in many other parts of the world. And it is when you hear such information, you get to know about such situation in other countries, what should be the responsibility of the government? A responsible government will sensitize its citizen, will caution its citizen, and will request its citizen to abide by the protocol, COVID protocol. And what did our health minister has requested, Mr. Rahul Gandhi ji? He has only requested that please follow the COVID protocol, because it is important that people who are going with you, who are accompanying you in Bharat Jodo Yatra, should not suffer because of
Okay,
you.
Ajay Kumar, here's the thing about COVID, which we know from the past, that once it starts spreading, then it's difficult to control. The BJP says, we didn't ask Rahul Gandhi to suspend the yatra so far. We're saying so now because of a real threat of a mutation from China spreading to India, then being contagious and spreading like wildfire across the country. We are trying to do this in national interest. Rahul Gandhi ought to rise above petty political lines and look at the bigger picture. Ajay Kumar.
So Rahul, a couple of things. First of all, I definitely and we still believe that the BJP is finding excuses to divert attention from what's happening on the Chinese border. Now that's set aside, coming to the COVID issue. You know, when Zafar was saying that it's happening in Brazil and Korea, if you remember in April 2021, it was happening in India. So the BJP's, you know, it's such a awful pretension of having a medical perspective or a public health perspective for a political objective. Because in April 2021, 19th of April, there were 20 lakh live cases, 2 lakh new cases every day, 2,000 deaths. Mr. Amit Shah removed a rally. Huge rally, Bengal elections. If you remember, Rahul, you were covering it, you guys were asking questions. When Madhya Pradesh government had to be, when they had to do the horse trading, then the COVID was at its peak. No problem. Yesterday, the Honorable Prime Minister goes to a wedding and maskless people, maskless Bharatiya Janata Party people walking happily. Today, the icing in the cake is, look, this is a party which doesn't believe in public health. Look, I would have been happy if they had the same standard. So today itself, Mr. Piyush Goyal, very masked up in Parliament, a very serious demeanor, and then he comes out and, maskless with all the children. He's guilty of, if he's so sincere, what was he doing with all these young children outside the Parliament?
Syed Zafar Islam, it's a case of differential standards. At the peak of the coronavirus, I remember in West Bengal, elections weren't suspended. Your netas went and did their big rallies at the highest levels in government, and therefore you can't now turn around, and that is when there were lakhs of COVID cases across India. Right now there are about 200. So you can't now say Rahul Gandhi Yatra band karo, while even the case of the Madhya Pradesh Assembly is right. You went on till the time you were able to bring the Kamal Nath government down. You went and campaigned in Kolkata, in West Bengal towards the end at the peak of the coronavirus. So that's good for you. It's not good for Rahul Gandhi and the Congress.
Rahul, when did we ask him to suspend his Bharat Todo Yatra? Did we? Did you read the letter? I'm sure that you must see the first para itself.
No, it says over here.
We have only requested,
cautioned
him and requested.
Keeping the public health situation in mind, please suspend the Bharat Jodo Yatra in national interest if it's not possible to follow COVID protocols.
If it's not possible, yes. So, subject to not following the protocol, then we have requested that you should think whether you should consider suspending the Bharat Todo Yatra if you are not following the protocol. So, what is the request? Request is just to follow the COVID protocol. Is that something which is wrong?
You're making too much of a big deal around this. Just follow the protocol. That's what the health minister is asking for, Ajay Kumar. Don't turn a molehill into a mountain. He's saying be responsible.
Rahul, so I want to ask you something. Who do you dislike most when you see anybody with double standards? Look, 20th, this gentleman writes a letter. 21st, the Rajasthan Jan Akrosh rally. Look, I've been a doctor myself, and my fundamental issue is that the sheer brazen political misbehavior on the part of this government. And I'll give you an example. 18th, Tripura had the Prime Minister's rally. I mean, this government is reacting on 20th. 21st, the BJP has this Jan Akrosh rally. 21st, the Prime Minister goes to a huge wedding without mask. There is no credibility. It's like people preaching from the pulpit who have no credibility in their statements. I would have been happy. And, they are...
Rahul, can I just come in for 10 seconds?
No, one second, Zafar, I'll complete. Zafar, sir, I'll complete. My question, Zafar ji, is, where is your credibility? Mr. Goyal wears a mask inside, comes out and, talks to children, photographs himself happily with children without mask. Prime Minister...
Let Zafar Islam respond to that. There is inconsistency. Dikhane ke liye mask pehante hain, when they are not on camera, they remove the mask. Some of this masking at this moment seems to be done for the camera. Zafar Islam.
Rahul, I think today the nation feels safe and secure purely because everybody have been vaccinated. Thanks to the efforts of the Honorable Prime Minister that people are feeling safe and secure today. But when you see what is happening in China, what is happening in other parts of the world, then it is the responsibility of the government to sensitize the people to at least follow the protocol, and they give the advisory to state government to follow the advisory. And what needs to be done, at least testing, find people who are impacted and then treat them. And if need be, then isolate them, quarantine them. But no letter has gone from the ministry or from any officers saying that you should suspend your rally instantly. Rather, they have been asked to follow the protocol.
Okay, so let's rise above this political back and forth. I want to go across to the two doctors of the broadcast.
Let me ask you one thing. Let me ask you one thing.
Okay.
No, let me ask you one thing, Dr. Ajay. Rahul Gandhi ji, today the parliament is on. The responsibility of a people's representative, people's representative, and especially those who are member of parliament, their responsibility is primary responsibility is
Zafar, can I
to be
explain?
in the
Okay.
parliament and discuss on the floor of the parliament. But he is doing politics. He is on the street instead of attending the parliament, despite the fact that he is the representative. He is the people's representative and an elected member.
Okay, Zafar
What is
Islam,
his
quick
primary
response.
responsibility?
I want to go to the doctors.
To attend the parliament, but he's not discharging the responsibility.
One second, Zafar, yeah, okay. You know, you were saying that member of parliament should be accountable. Here is a prime minister, maskless yesterday in a wedding. Have you written to all chief ministers of the state to stop large gatherings, follow COVID protocol? No. Now, shame on this whole system. You have not written, the minister has not written a letter to any state government to stop political rallies and large gatherings without COVID protocol. So please don't preach, yeah. It's offensive, I'm telling you honestly. If you do it, please do it across. Don't pick up your political opponents to and try to cover it up with the public.
Okay, I hear you. Let me go across to Dr. Subramaniam Swaminathan, who heads infectious diseases at the Gleneagles Global Health City. Outside of this politics, Dr. Swaminathan, where do you think the medical good sense lies? Is it time to start pulling back, cancelling party plans over Christmas and New Year's? Or is this more about politics and we aren't at a stage yet where we need to hunker down?
So the biggest problem is the lack of data. I'm a man of science. I deal with facts and data. And therefore, I don't think we should be talking about this from an emotional point of view, but more from a rational point of view, because it's going to affect people very badly if we start doing things like that. China is paying the price for, doing emotional strategies, and we should avoid that. Now, as far as we are concerned, there are a lot of things which tell us that we are not immediately vulnerable. But having said that, the data is still incomplete, and we don't have all the pieces of data that would reassure us that there is absolutely no problem. So I think some amount of caution is certainly justifiable. Now, how much it is, it all depends. See, I think it has to be weighed between disrupting the economy and allowing things to go unbridled. Simply because that the BF7 variant was detected as early as October 22nd. And today in the Hindu, I read that it was even detected way back in July. I'm not sure exactly how long ago. So obviously, these variants have been in circulation in India for quite some time. The unfortunate problem is we have not collected enough data on it. And I think we are probably paying the price for that. Because if the circulating variants in India are absolute same as in China, then obviously we are not in such bad a shape. And therefore, we may not need to react as aggressively. On the other hand, if there are new variants yet to come and we have not budgeted for that, obviously that would mean we need to be more careful. So obviously there are certain course corrections we need to do because our vaccines are also quite some time ago. Many people still haven't got their booster. So I think it would be more prudent to worry about the fact that we haven't got the booster done. We haven't put enough speed into the nasal vaccine because that's supposed to be a game changer. Immunologically, it's supposed to be much better. And we are not doing wastewater sampling, which in my opinion is probably a big mistake. We should be doing lots of that. The CDC is putting in a lot of effort into establishing infrastructure to do wastewater sampling because studies have shown that that's the best way to assess what's happening in the community. And I personally like that because it avoids all the political discourse around how many cases there are and how it happened.
So you're basically saying India not immediately vulnerable, but there isn't enough data. You'd like more data.
There's enough reason to be cautious. There's
cautious but not vulnerable.
But not to lose our heads.
Ankita Baidya, from your perspective, is there really a need to hunker down, start cancelling New Year plans because of what's happening in China? Or would that be a bit of an exaggeration and we don't really need to start panicking because the threat really is across the Himalayas, it's not in our side yet?
Yeah, see Rahul, the panic is not the solution, but yes, we need to pull up our socks. If we see what is happening in the neighboring countries, as Dr. Subramaniam has rightly pointed out, this variant was detected as per the records available in the month of October itself, doesn't created much panic related to COVID spurt of cases or hospitalization as such. But my worry is the precautionary dose around only 27 to 28% of our population has taken that, and we have forgotten about COVID, not taking any COVID appropriate behavior. So it is important that we understand we should not loosen up our guards just thinking we have hybrid immunity. Very true. Whatever has happened in West has always not replicated in our country, but certainly we need to see what we have seen in the second wave, and we should not repeat it. So it's good that the government is taking some actions on it, the preventive actions on it. They are talking about it because it has to come from higher level in all sense, whether it comes related to precautionary dose, mandatory that you need to take it. As we had seen that last year, we need to carry a vaccination certificate during travel. So some steps has to be taken that the people go out for the vaccination of their precautionary dose if they have not taken, and follow the COVID appropriate behavior. So precaution
So the Prime Minister today chaired a high-level COVID review meeting. He emphasized adherence to COVID-appropriate behavior. The message from the government was clear. India is ready and vigilant, but there is no need to panic.
Prime Minister Narendra Modi's big COVID review. Amid global surge in COVID cases, particularly the runaway infections in China, India, whose COVID fight was lauded across the world, is rising to the challenge again. Here are the steps the government is mulling to fight any threat of COVID's return. To be detailed in advisory for states from centre. This is renewed focus on precautionary vaccine dose. Steps like mask mandates are likely to make a comeback. Curbs likely on New Year bash. Big focus to be on social distancing. Apart from screening of all travellers from China and random testing for international flyers. Also increased quarantine and testing measures.
अंतर्राष्ट्रीय हवाई अड्डे पर विदेश से आने वाले हवाई यात्रियों के 2% कोविड RT-PCR रैंडम सैंपलिंग भी आज शुरू कर दी गई है। माननीय प्रधानमंत्री श्री मोदी जी के समर्थ नेतृत्व में भारत पहले से ही अमल में टेस्ट, ट्रैक, ट्रीट, वैक्सीनेशन, कोविड एप्रोप्रिएट बिहेवियर का पालन नीति के साथ कोविड मैनेजमेंट कर रहा है, उसे आगे भी चालू रखेंगे।
Despite alert, the centre has advised against mass panic.
We are here right now at the Charbagh railway station in Lucknow, where you can see the travellers and the passengers who are coming, but there is no as such, follow of the protocol so far. People have actually forgotten to use the mask. There are few passengers who are indeed using, but most of them are visible without using the mask, which is the situation going on.
India has reported 4 COVID-19 cases of BF7, the sub-variant of Omicron strain of COVID-19, but it seems in Uttar Pradesh, people haven't learned any lesson. कोरोना वापस आ गया है क्या? हाँ? कोरोना क्या फिर से वापस आ गया है?
हमें तो मालूम नहीं पड़ा भैया।
नहीं, चाइना में जिस तरह से हाकार मचा है, सरकार ने भी अब कहा है कि सोशल डिस्टेंसिंग का पालन किया जाए।
किया जाए तो भैया जो सरकार कहे वो तो करना ही पड़ेगा।
क्या लगता है, मास्क का दौर वापस आ गया है?
आने वाला है।
कैसे?
जिस हिसाब से जिस हिसाब से चाइना का हॉल है ना, उस हिसाब से लगी रहा है।
अभी प्रिकॉशन लेना बहुत जरूरी है, क्योंकि सर्दी का दिन है, ज़्यादा कोविड इसी टाइम फैलता है। हर साल पिछले 2 साल से सर्दी के समय ही कोविड हो रहा है।
States too are pulling out all stops, preparing for any possible spike in cases.
ರಾಜ್ಯದಲ್ಲೂ ಕೂಡ ಕೋವಿಡ್ ಅನ್ನು ನಿಯಂತ್ರಣ ಮಾಡಲು ಪ್ರಿವೆಂಟಿವ್ ಕ್ರಮಗಳನ್ನು, ಮುಂಜಾಗ್ರತೆ ಕ್ರಮಗಳನ್ನು ಏನೆಲ್ಲ ತೆಗೆದುಕೋಬೇಕು ಅನ್ನುವಂಥದ್ದನ್ನು ನಾವು ಮಾಡ್ತೀವಿ. ಆದರೆ ಸಾರ್ವಜನಿಕರಲ್ಲಿ ನಾನು ಹೇಳಕ್ಕೆ ಇಚ್ಛಪಡ್ತೇನೆ, ಇದರ ಬಗ್ಗೆ ಯಾರಿಗೂ ಕೂಡ ಭಯ ಅಥವಾ ಆತಂಕ ಬೇಕಾಗಿಲ್ಲ. ತಜ್ಞರ ಸಲಹೆ ಏನು ಹೇಳ್ತಾರೆ ಅದನ್ನು ಪರಿಪಾಲನೆ ಮಾಡಿದರೆ ಸಂಪೂರ್ಣವಾಗಿ ನಿಯಂತ್ರಣ ಮಾಡಬಹುದು ಅನ್ನುವಂಥದ್ದು, ಮತ್ತು ವಿಶೇಷವಾಗಿ ಬೂಸ್ಟರ್ ಡೋಸ್ ಬಗ್ಗೆ ಒಂದು कार्यक्रमों रूपिಸುವಂತ साध्यते ಇವತ್ತು
उत्तर प्रदेश सरकार सतर्कता के साथ आगे बढ़ रही है। हमने ऐसे सभी स्थल जहां भीड़ भाड़ वाले हैं वहां कोविड का प्रोटोकॉल पालन किए जाने के लिए सलाह जारी की है, एडवाइजरी जारी की है।
अभी मध्य प्रदेश में कोई ऐसी चिंता की स्थिति नहीं है, पर जो भी स्वास्थ्य मंत्रालय का दिशा निर्देश है उसका हम पालन करेंगे।
A stealth enemy that we fought twice. With a little caution and alertness, India may prevail over COVID yet again. With Samad Srivastav and Abhishek Mishra in Lucknow, Bureau Report, India Today.
China is dealing with the kind of chaos that it is because they didn't have these kind of COVID waves when countries like the United States, countries in Europe and India were suffering, and therefore their population doesn't have immunity. But the big fear is that there could be a mutation from the current round of infections which could spread to countries across the world. How real is that fear, Dr. Subramanian Swaminathan, that somewhere in the mainland of China, because of the fact that elderly aren't vaccinated, because the population isn't immune, that there can be a mutation which could then become the world's migraine in the new year?
That's exactly the big concern. So while we have a lot of answers on why things are happening in China and why we seem to be very sheltered, the big unknown is the risk of mutation. And let's remember that the risk, that the number of mutants that arise is directly proportional to the mass of mutating virus. And given that there is active replication in so much of the population, and the biomass is actually very, very high, there's going to be multiple mutants that come out of it. Remember, as mutants come out, 99.99% or so will not be of any consequence to us. Maybe 1 in 10,000 or 1 in less than that is going to be of consequence. But given that, the number of mutations are going to be possibly in the millions, this could be a concern for us. Especially if they have the immunological breakthrough that Omicron had, and at the same time, they managed to retain some virulence and severity genes that were associated with some of the earlier mutants. So I think that is going to be a concern. That's why we need to be monitoring the situation very, very carefully. And given that China has been traditionally very cagey about their data, it's going to remain a challenge. And I think we need to be very, very careful. And this is where the international community needs to work together in pooling the data together so that we don't have nasty surprises.
No, but which is also why, Ajay Kumar, that some precaution isn't a bad idea. So when the Modi government says follow some protocols at mass gatherings, and you've run a hospital chain, this is, if you leave the politics aside, this is not unwise, unscientific advice. This is good advice which you could possibly, as model citizens, take in your stride, ignore the fact that it's coming from your opponents and say, let's do the right thing.
So, Rahul, point taken. The question again is, first of all, whenever you have a public health challenges, and the previous two scholarly speakers before that, and even Zafar is a scholarly gentleman. I would like to include, but medically well-informed people were on the panel. The issue is, what are the first priority? The first priority, even if you look at it from a medical perspective, is to get the booster system in place. All right. The second issue is, I'm telling you, we will follow every protocol. The Bharat Jodo Yatra will not violate anything based on the protocol. I think we are ready to set up. My question to this government, and you will also agree with it, is it's vicious when you use such double standards. As political people, Zafar, I would request him, please use the same standards across. And we will follow it. I think we need to be careful. We take that matter as a very responsible
but
party.
This is a good point. That why is that letter written only to the Bharat Jodo Yatra? You haven't told your government in Madhya Pradesh, your government in Karnataka, or anywhere else to stop political gatherings. They are going on business as usual, and you somehow seem to be picking on that one yatra which is being run by your principal opponent.
No, Rahul, you have to understand that this issue was discussed, that has been discussed on the floor of the parliament. The health minister has apprised the members and also sensitized them, and because they are people's representative. Secondly, the Honorable Prime Minister also had a long discussion with the Chief Ministers and other important dignitaries. Why? Because they want to sensitize and make them accountable and responsible both. Third thing which is important, that you are saying why it has been written to Rahul Gandhi ji. It is not only to Rahul Gandhi ji, this has been sensitized to everyone, but he happens to be from the principal opposition party, and he is leading a Bharat Jodo Yatra where people from different part of the India are joining him. They are at risk. And it is the responsibility of the government to at least sensitize him. We didn't want him to suspend it, nor that we are interested in him suspending, because any such yatra is helping us, not him. And it is so evident from the fact that the outcome in Gujarat, we have won 156 out of 182. That only suggests that this kind of yatra will only help Bharatiya Janata Party and not Congress Party. Yet, we are a sensitive government, we are a sensible government, and we are very sincere about the people of this great country.
Okay.
That's why
in the middle of all of this, the World Health Organization has finally admitted that China is not sharing adequate data which is reliable and thorough. The global health body has said that China risks grossly underestimating the true death and case toll. Since the beginning of the pandemic, the WHO has been siding with China and has been under fire globally for ignoring the very clear danger signs emanating from the Chinese mainland. Here's a look at how the WHO time and again has seemed to favor China and ignore good sense.
Everyone recognizes this face, a household name thanks to the COVID pandemic. But Dr. Tedros Adhanom, chief of the World Health Organization, has led the WHO at a time when it suffers worldwide distrust, anger, and a sense of betrayal.
WHO needs more detailed information on disease severity, hospital admissions, and requirements for ICU support. WHO is supporting China to focus its efforts on vaccinating people at the highest risk across the country, and we continue to offer our support for clinical care and protecting its health system.
Even the latest COVID crisis in China is being directly linked to the WHO's breathtaking incompetence and cowardly unwillingness to crack the whip on China. As the world waits to see if China's new nightmare could ripple across the world, it is a good time to remind ourselves that the WHO has largely failed in protecting the world. Failure number one. The WHO declared a global agency at least a week too late, totally allowing the initial spread of the coronavirus beyond China, a crucial week that made a devastating difference. The second major failure was the WHO's disastrous policy advisory that travel restrictions should be a last resort. This epic error practically delivered the virus to every corner of the world. The third major failure was the WHO's bumbling initial advisories on droplet transmission, confusing countries and governments and leading to disastrous lack of clarity on precautions. The most epic failure by Dr. Tedros and the WHO has been the organization's hurried approval of Chinese vaccines, which have now proven to mostly be subpar, if not completely useless, and fueling the huge surge in caseload in China. What made this worse is that the WHO conversely blocked and delayed access to India's Covaxin, which has since proven to a far more efficacious vaccine than many of the others that the WHO eagerly approved under pressure from countries including China. Above all, the WHO has operated like a vassal of the Chinese state, barely criticizing the openly draconian and bungled zero-COVID policy of the Xi Jinping government, and in many cases defending Chinese policies. It's been 3 years since the Wuhan virus went out into the world, giving global citizens their worst living memory. As India and the world navigate next steps in a battle that clearly isn't over, it would be prudent to bear in mind that those mandated with protecting the world have constantly failed. Bureau Report, India Today.
Data coming out of China is imprecise and unreliable. But global estimates suggest that China is at this moment likely experiencing about 1 million COVID infections every day, and about 5,000 people could be dying at this moment. This is being called the world's biggest COVID outbreak ever. That's what's happening in the Chinese mainland. Just if you look at what happened globally, apply the same trends to China. The situation could get worse for the country with a population of 1.4 billion. Here's the latest from China based on reports from Chinese social media and what global experts are saying about the current situation inside China.
This makeshift fever clinic has been set up at a stadium in downtown Beijing. Since starting operation on December the 14th, it provides medical services every day from 10 a.m. to 10 p.m. Most of the medical workers here are from local public hospitals. Some are from Shandong province who came to support Beijing amid this wave of COVID-19 resurgence.
主要面对的对象呢，患者呢就是16岁到65岁之间的。
We mainly receive patients aged from 16 to 65 who suffer from respiratory tract infections. Those who have severe underlying diseases or need emergency treatment are suggested to go to hospitals if it's necessary, rather than coming to this simply equipped fever clinic.
As you can see, several tents have been put up at the stadium, and they are used as a temporary registration office, consulting rooms, and the pharmacy. It's freezing cold these days in Beijing, so setting up such a fever clinic at the stadium can shelter patients from waiting in long lines in wind.
It takes me only about 5 minutes to wait in line. I got fever several days ago. Now with the medication, I won't be worried.
My wife, my mother, and I all tested positive. We had fever. I think it might be easier to get cross-infection if I go to the hospital because there could be more people there. So I came here to be prescribed fever and coughing drugs.
Doctors say a week ago, when they started work here, they treated patients until midnight. But now they're seeing fewer people.
最多的时候，我们一天呢能够接诊到800到850名患者的这个人。
When we first started operation, there were about 800 to 850 patients coming here every day. But in recent days, the number of people continues to decline. Yesterday, we received about 400 patients. I think this is a positive signal.
Local government says the supply and demand for medical care and drugs is still in a tight balance in Beijing amid the current seasonal influenza and COVID-19 infections. But the capital city is taking measures to increase its capacity to respond.
Latest data shows Beijing now has over 1,200 fever clinics, including those in hospitals and communities. So far, 8 districts in Beijing have transformed public facilities such as theaters and stadiums into makeshift fever clinics to help relieve the burden at hospitals. And all the community health service centers have also set up diagnosis areas for residents who show symptoms such as fever and coughing to seek medical help near their home. Huang Yue, CGTN, Beijing.
The COVID variant unleashing the crisis in China is the BF7. This variant is said to be much more transmissible than variants that have wreaked havoc in India. There are 4 cases of BF7 in India so far. But the good news is this variant has been around at least since July and hasn't spread widely so far. However, it is being considered a matter of concern. Our health correspondent Sneha Mordani with this report.
We're decoding BF.7, the sublineage of Omicron, which is wreaking havoc in China. So this essentially is a sublineage of Omicron, BA.5. Symptoms are similar as other Omicron variants. In that sense, nothing has changed. BA.7 carries mutation R3460 that aids escape antibodies. Omicron, remember, has mutated over 500 times in 1 year. Strongest infection ability of BA.7 is the reason why the infection rate is so high. That is the reason why so many people are getting sick. The reproductive value of more than 10, it actually is hovering around 10 to 18, which means one infected patient can infect up to 10 and more. Higher immune escape, shorter incubation period is what makes it so problematic. Higher transmission rate, like we mentioned. It's known to cause serious illnesses in those with weak immunity, and that's the reason why so many people, especially the vulnerable in China, are dying. Now, it's not just been seen in China. It has already been seen in many other countries, including in India. It was seen in India as early as September this year. It's also been seen in the UK, in US, Belgium, Germany, and Denmark.
Coming up on the other side, video of an Indigo Airlines crew member schooling an unruly passenger goes viral. Details on the other side as the internet lauds the chaos.
Why are you yelling? I was shut up! You shut up! I'm sorry, you cannot talk to me like that. I'm also an employee here. Your boarding pass shows that this is the
भैया जी हमला। भैया जी 10 गोलियां ले ले।
गोलियां नहीं रज्जा, गोली।
पर बाहर तो 10 लोग हैं।
10 हो या पूरी बस, अब तो बस 1 है तो डन है। इसको कोई वॉच कराओ। जब वॉचो मिले ढेर सारे OTT ऐप्स एक ही प्लान में, तो हर कोई बोलेगा वॉचो 1 है तो डन है।
वॉचो प्लान स्टार्टिंग एट जस्ट 42 रुपीज पर मंथ। आज ही सब्सक्राइब करें और पाएं सिलेक्ट प्लान्स पर 1 महीना कॉम्प्लीमेंट्री।
Make your media plan smarter with India Today Live TV on your connected devices. Amplify your brand with 100 million smart internet viewers. To advertise, mail us at sales@aajtak.com.
At 9 p.m. on the news today with me, Rajdeep Sardesai. As Prime Minister Modi and several chief ministers convene emergency meetings to discuss preparedness to deal with the latest COVID scare, we'll be taking all your most frequently asked questions to one of the country's top doctors, Dr. Randeep Guleria. What lies ahead in this holiday season amidst rising COVID cases across the world? Also, epicenter China. We'll have ground reports on how the pandemic is spreading there. And among my newsmakers tonight, actor politician Kamal Hassan. Why is he joining Rahul Gandhi's Bharat Jodo Yatra? All that and much more on the news today.
An altercation between an Indigo flight attendant and a passenger has gone viral. When a passenger started yelling at the crew over a sandwich, one of the air hostesses gave it back to him, telling him that she's not his servant. Interestingly, while the attendant has been winning hearts for standing up to this unruly passenger, Indigo Airlines has said it puts its customers first.
Shut up! You shut up! I'm sorry, you cannot talk to me like that.
Turbulence on board.
Shut up!
Words that won't fly with the cabin crew.
You shut up!
An air passenger's rude entitlement caught on camera. The flyer bound to Delhi from Istanbul in Turkey loses temper over meals. Berates a trained flight attendant over food.
Please try to understand there's a car.
He yells at the crew member.
We can only serve what you're. Why are you yelling? Because you are yelling on us.
When politeness doesn't work, she pays him back in the same coin.
I was please. Shut up! You shut up!
The video of this altercation between a flyer and a flight attendant has gone viral.
Yes, I'm an employee. I'm not your servant. And I'm an employee. I am not your servant. Then you don't get on.
Many internet users have found the passenger's behavior on board Indigo Flight 6E12 on December 16 inappropriate. The airline has responded to the incident, calling passenger comfort its top priority. We are looking into the incident and we would like to assure that customers' comfort has always been our top priority. We are committed to providing the best experience at all times. But when flight attendants are primarily duty-bound to keep their passengers safe in modern aviation, flyers too are expected to shed outdated notions, giving cabin crew the courtesy they so well deserve. Bureau Report, India Today.
Thousands of Lingayats, led by BJP MLA Yatnal, staged a massive protest outside the Karnataka Assembly today. They demand a larger slice of the quota pie. Panchamasali Lingayats, who constitute 60% of the Lingayat population, have claimed that they have not been given the much-needed political representation. They have power to influence about 100 seats in the Karnataka Assembly. They've called off their agitation for the moment after an assurance from the Bommai government.
Stepping up pressure on the Basavaraj Bommai government in the midst of the ongoing assembly session in Belagavi and amid heavy police deployment, the Panchamasali Lingayats have intensified their stir for more reservation. The community, in a show of strength, went on a Padayatra from Rani Chennamma's Samadhi in Bailahongal to Suvarna Vidhana Sauda in Belagavi. They have threatened to gherao the assembly building if their demands are not met.
100% I hope that Karnataka government बसराज बोम्मई हमारा समाज 80% बीजेपी का सपोर्ट है. हमारा समाज का ये न्यायबद्ध आरक्षण है तो ये कोटा करने के लिए इसलिए ये आज हम सरकार हमारा मुख्यमंत्री ने हमारा कोटा को फुलफिल करने के प्लान किया था. अगर उसने नहीं फुलफिल किया था हम विधानसभा प्रवेश करने के लिए लड़ाई शुरू करें.
सर अगर नहीं दिया तो क्या है सर?
अगर नहीं दिया हमने विधानसभा के सामने वो लड़ाई शुरू किया था. विधानसभा को प्रवेश करने के लिए तैयार किया था.
The Panchamasalis, a sect within the Lingayats, currently get 5% reservation under 3B category of OBC. They are demanding to be moved to 2A category, which will give them backward class status and also 15% reservation. The Panchamasali Lingayats are the BJP's core vote bank. The Bommai government is trying to pacify the protesters.
ನೋಡಿ ಅವರು ಎಷ್ಟು ಜನ ಬರ್ತಾರೆ ಅದಕ್ಕೆ ಸರಿಯಾದಂಥ ಬಂದೋಬಸ್ತ್ ಏರ್ಪಾಡನ್ನು ನಮ್ಮ ಪೊಲೀಸ್ ಅಧಿಕಾರಿಗಳು ಮಾಡಿದ್ದಾರೆ. ನನಗೆ ನಂಬಿಕೆ ಇದೆ ಅವರು ಯಾವುದೇ ಕಾನೂನು ಸುವ್ಯವಸ್ಥೆಯನ್ನು ಹದಗೆಡಿಸುವಂಥ ಕಾನೂನು ಕೈಗೆತ್ಕೊಳ್ಳುವಂಥ ಯಾವ ಕೆಲಸವನ್ನು ಮಾಡಲ್ಲ. ಅವರು ಡಿಮಾಂಡನ್ನು ಕೇಳ್ತಾರೆ ಅಷ್ಟು ಬಿಟ್ಟರೆ ಬೇರೆ ಏನು ಇದನ್ನ ಮಾಡ್ತಾರೆ ಅಂತ ಹೇಳಲಿಕ್ಕಾಗಲ್ಲ. ಆದರೂ ಕೂಡ ಎಲ್ಲ ಬಂದೋಬಸ್ತುಗಳನ್ನು ಪೊಲೀಸರು ಮಾಡಿದ್ದಾರೆ.
With assembly elections slated next year, the BJP government in the state is wary of upsetting the Panchamasalis. But it is treading cautiously as it can't afford the displeasure of other communities. With Nagarjun Dwarkanath, Bureau Report, India Today.
This is where I wrap up the news track tonight. For your time and your trust, thank you very much. I look forward to seeing you at 8 p.m. tomorrow evening. Till then, from all of us here, goodbye, good night.
Tensions at the Belagavi border of Karnataka and Maharashtra escalated into violent proportions after nearly 300 people from Maharashtra who tried to enter Belagavi were sent back. Owing to the violent situation in Belagavi, the Karnataka police imposed Section 144 restricting any politician or activist from Maharashtra against entering Belagavi. But Maharashtra's Mahavikas Aghadi opposition has refused to honour calls for a status quo. NCP Sanjay Raut fired back, saying he will enter Karnataka like China entered India.
वैसे तो उनकी सरकार जो दिल्ली में बैठी है वो भी इंच की भाषा करते हैं कि चाइना को इंच भी नहीं देगी, लेकिन चाइना घुस गया है. चाइना घुस, हम भी घुसेंगे. घुसने के लिए हमें किसी की परमिशन की ज़रूरत नहीं है, लेकिन हम मानते हैं ये देश एक है, ये मसला बातचीत से सुलझ सकता है।
The Maharashtra opposition has also raised the matter in the assembly, mounting pressure on Chief Minister Eknath Shinde, accusing him of staying mum on the matter. Maharashtra for the last 6 decades has been appealing to merge nearly 865 villages, including Belagavi, Karwar and Nippanni, with Maharashtra. Karnataka, of course, has refused to part with its territory. However, tensions along the border has never been this heated. Karnataka Home Minister Araga Gnanendra has hit back at Sanjay Raut, calling him irresponsible and ignorant. Karnataka is all set to pass a resolution on the same in both houses of the assembly, reinforcing status quo. The centre too had intervened. Home Minister Amit Shah tried negotiating truce between the neighbours, asking states not to stake claim to any territory until the Supreme Court decides on the matter. Nonetheless, the matter has certainly become difficult for the centre too, as both states are governed by the BJP. The opposition is now visibly using this as opportunity to impose their demands.
held its 8th annual Google for India event in Delhi, where a couple of big announcements were made by the company. A lot of emphasis was on AI. In fact, Google announced its plan to decode doctors' handwritten prescription using artificial intelligence. However, the company said they're still fine-tuning this service of reading a prescription just like your pharmacy guy would, but with better accuracy. They even demonstrated an example.
So let me show you how our model works. Let's take this copy of my prescription, open a camera and point at it. Let's see if our model can highlight the medicines correctly. The first one is correctly identified as Alefix alongside all the others. While the initial results have been heartening, much work still remains to be done before the system is ready for the real world.
Apart from this, Google said that it will be using artificial intelligence to check an X-ray for tuberculosis. The company is also building a clinical intelligence engine that can be used to diagnose common diseases. Google also said that it plans to build an artificial intelligence machine learning model in partnership with the Indian Institute of Science. This project will be called Project Vani, and it will collect language samples from 773 districts of India. Project Vani will also ensure that the data that is collected and produced under it will be open sourced. The company also explained how it will be using AI for agriculture. They will be using remote sensing capabilities to give an overview of agriculture in the country. They've also developed a landscape understanding model, which is being piloted in Telangana at this moment. This model can identify fields, natural and man-made water bodies, and will also be able to detect events for the fields, such as when the crop was sown and when it was watered. Google also launched Project Bindi, which will allow to advance research and build an understanding of its AI models, which are women inclusive. This is with an intention to make tech space more inclusive of women from all walks of society. The company also launched an app that can understand people with non-binary speech. It's called Project Relate. Google will also be launching a multi-search feature, which is search using text, pictures, audio, video, and will be available for many Indian languages and not just Hindi and English. Google also announced an integration with DigiLocker for government identity documents. It will be using AI to identify and recognize important documents on Google Files app.
Kerala's public health, all political parties travelling from different parts,
Armed with facts,
looking at political black.
she takes the news by its horns.
Do you think the future of these students are not hampered?
fierce, bold, and direct, setting the tone for the biggest stories from every corner and every angle. Expect nothing but the unfiltered truth.
News first, niceties later. Watch me, Nabila Jamal, on India Today.
Tonight at 9 p.m. on the News Today with me, Rajdeep Sardesai. As Prime Minister Modi and several chief ministers convene emergency meetings to discuss preparedness to deal with the latest COVID scare, we'll be taking all your most frequently asked questions to one of the country's top doctors, Dr. Randeep Guleria. What lies ahead in this holiday season amidst rising COVID cases across the world? Also, epicenter China. We'll have ground reports on how the pandemic is spreading there. And among my newsmakers tonight, actor politician Kamal Hassan. Why is he joining Rahul Gandhi's Bharat Jodo Yatra? All that and much more on the News Today.
So sorry.
Presented by धूल आए पर घर पे ना टिक पाए। Co-presented by Star Health Insurance, the health insurance specialist. Co-powered by Watcho, one hai to done hai. Co-powered by Green Lamb Laminates, kuch mera, kuch tumhara. Co-powered by the bold look of Cola.
Good evening, hello and welcome. You're with the News Today, your primetime destination news, newsmakers, talking points. The big talking point this Thursday night, India's COVID alert. FAQs with Dr. Randeep Guleria, former AIIMS director, will be taking all your questions today as we focus on the latest COVID scare. But first, as always, it's time for the 9 headlines at 9. Prime Minister Narendra Modi chairs a crucial COVID review meeting, advises citizens to mask up, says COVID is not over yet. Centre advises states to heighten surveillance measures. Big boost to India's COVID fight. First indigenous needle-less vaccine ready to roll out. India today learns the Covaxin nasal vax will be given as a booster to those above 18 years of age. The World Health Organization expresses concerns over the COVID surge in China, says China might be struggling to keep track of infections as it experiences a big spike in cases. Pandemic politics continues to rage. Rahul Gandhi hits out of the centre, claims COVID was being used as an excuse to stop his yatra as the BJP fears its success. The Bommai government in Karnataka passed a resolution in the State Assembly against Maharashtra's claim to Belgavi. Karnataka resolution seeks status quo on the border dispute. The Maharashtra government reopens the high-profile suicide case of Disha Salian. The talent manager of late actor Sushant Singh Rajput announced a special investigation team to dig deeper into the reasons that led to her death. India-China stalemate continues. 17 round of talks failed to break the logjam on de-escalation along the line of actual control. Meet comes days after Chinese troops clashed with Indian soldiers in Tawang on the 9th of December. Ukraine's President Vladimir Zelensky tells the US Congress American aid is not charity, calls it investment in global security. Zelensky is on his first known trip abroad since Russia invaded Ukraine in February. And RRR's iconic hit Nattu Nattu in the race for Best Song at the Oscars. 4 Indian movies, including The Cello Show, also make it to the Oscar shortlist. Okay, let's first turn to the story that's breaking right at the very top, the COVID scare in the country. The Prime Minister now reiterating that the COVID scare isn't over yet. The Prime Minister warned citizens against any form of COVID complacency. This, remember, against the backdrop of the surge in COVID cases in China caused by the BF7 subvariant. States have been asked to ramp up hospital infrastructure. The Prime Minister is advising all to mask up, but remember, masks are not mandatory as per a COVID protocol except Karnataka, which has said that it should be mandatory when you're indoors. Milan Sharma joins us. Milan, does the government have an official COVID protocol at the moment on this latest surge in cases, or is the government simply playing safe?
So from the central government's perspective, they have put the onus on states. As you mentioned, that Karnataka is putting in rules according to its own state and governance there. So is Delhi. As you see, Arvind Kejriwal also did a press conference today. He said that we are not making masks mandatory in Delhi. So different rules for different states will follow. Of course, after the Prime Minister's meeting that has happened for the review of COVID situation in India, one of the key takeaways that I have seen in this meeting is that we need to increase testing in states, of course, because only if we test, we'll be able to track cases. And the surveillance that needs to be improved once again at the international airports. That is where perhaps there's a scare that a mutant or a variation of the variants of COVID-19 could come in. But apart from that, even the PM has not pressed the panic button yet. And therefore, there's no direct narrative that's coming from the central government to put in any sort of curbs or restrictions at the moment. Which is why I think at the central level, the government is playing safe, leaving it on to the states to implement